Hi, my name is Amanda Reichenbach, and I chose to look more into epilepsy and its relationship to physical activity. I know a few individuals with epilepsy, and before this assignment, I knew minimal about the disorder, especially in regards to its relationship with physical activity and exercise. Epilepsy is a central nervous system disorder that affects the nerve cell activity in the brain, resulting in unpredictable seizures. It is the fourth most common neurological disorder and affects people of all ages. Each person's experience with epilepsy and the seizures is different, which makes diagnosing the disease somewhat difficult. It is usually diagnosed after a person has had at least 2 seizures that were not caused by another known medical condition. 1 in 26 people in the U.S. will develop epilepsy at some point in their lifetime. Epilepsy results in unpredictable seizures. A seizure is a sudden urge of electrical and chemical activity in the brain which affects how a person appears or acts for a short amount of time. There are 2 types of seizures, generalized seizures and partial seizures. You can see the difference between activity in a normal functioning brain and an epileptic brain in the pictures that I have on the slide. Partial or focal seizures occur in one part of the brain. These seizures account for 60% of the seizures individuals experience. There are simple focal seizures where the person will remain conscious but experience unusual sensations, and there are also complex focal seizures, which result in a loss of consciousness. Some individuals may smack their lips, swallow repeatedly, or engage in other random activity. Following the seizure, the person may remain confused for several minutes. The other type of seizure, generalized seizures, involve both sides of the brain. There are many different types of generalized seizures. Absent seizures are where the person appears to be staring into space and are non-responsive for a few seconds. These occur mainly in children and can sometimes even go unnoticed due to the short duration. Tonic seizures result in a brief stiffening of the muscles in the legs, back, and arms. Myoclonic seizures result in muscle twitches and jerks. They can be a small facial twitch or massive jerks of the extremities. Atonic seizures result in a loss of normal muscle control and can lead to the individual falling. Tonic-clonic seizures result in an abrupt loss of consciousness, usually resulting in a fall, followed by the body stiffening and then violently jerking. Loss of bladder control is quite common, and the person usually goes into a deep sleep following the episode. In this picture, in A, you can see the partial seizure affects a portion of the brain, and whereas in part C, the whole brain is affected during the seizure. Typically, epilepsy results from anything that disturbs the normal pattern of neuron activity in the brain. Some risk factors leading to epilepsy include head injuries, brain tumors, strokes, a brain infection such as meningitis, family history of epilepsy, and dementia associated with age. However, in more than half of epilepsy cases, doctors will not be able to identify a specific cause, and this is known as idiopathic epilepsy. Certain factors are known to provoke seizures in people with epilepsy, and these are known as triggers. It is important to learn what triggers an individual's seizures to prevent this activity. Some triggers include missed medications, lack of sleep, sleep disturbances, illness, psychological stress, heavy alcohol and drug use, nutritional deficits, and poor eating habits. When an individual experiences a seizure, many different physiological and psychological changes occur throughout the body. The individual can begin to feel hot, cold, clammy. They can appear to be pale or flushed. They can experience nausea. They may feel fear or panic. They may have racing thoughts, headaches. Some individuals feel changes in senses. They may feel numbness, tingling, hearing loss, unusual smells, sounds, or tastes. Some individuals experience blackouts, memory lapses, extreme confusion. Seizures can also lead to difficulty with speaking, breathing, excessive drooling, and even biting one's tongue. Some seizures result in muscle twitches, muscle stiffness, and loss of muscle control. This shows the different effects that a seizure can have on the body. There can be visual effects, somatosensory, motor, autonomic, auditory, and this happens during the seizure, and we talked about some of them in the slide before that. Diagnosing epilepsy can be very difficult because of the unpredictability of the seizures and possible other medical conditions that actually result in seizures. It is important to tell the doctor everything that you remember from around the time the seizure occurred. The doctor will ask you questions regarding sleeping patterns, activities that you did that day, the time of the day the seizure happened, how the seizure began, did you have any warning signs, what happened during the actual seizure, like things we talked about before, and how you felt afterwards. Neurologists use a variety of tests to diagnose epilepsy. Physical exams and blood tests are used to ensure that the individual is not experiencing another medical condition which could lead to seizures. An EEG, which is also known as an electroencephalogram, records the electrical activity of the brain by placing small electrodes on the scalp, and it is meant to determine if there is any abnormal brain electrical activity going on. A neurological exam may be done to test the functioning of the patient's muscles, senses, reflexes, and mental functions. Sometimes an MRI, CAT scan, PET scan are done to look more closely at the brain and the activity that's going on. Most people with epilepsy can become seizure-free by taking anti-epileptic medications. Others may be able to decrease the severity and frequency of the seizures through medications. If medication does not work, surgery is an option if the seizure is occurring in a specific part of the brain, which is usually a partial seizure. A ketogenic diet can also be beneficial as well because an elevated level of ketone bodies in the blood leads to a reduction in the occurrence of epileptic seizures. A ketogenic diet is very high in fat, low in protein, and carbohydrate-free, and it changes the way that the energy is used in the body. Being diagnosed with epilepsy does not mean that the individual cannot exercise. Physical activity can actually reduce the risk of epileptic seizures by reducing stress levels and improving cardiovascular and psychological well-being. Before beginning an exercise program, it is important to have clearance from your health care provider after a medical exam. It is also important to design a program that maximizes the benefits with the fewest risks. And it's also very, very important to continue taking medications as prescribed and to understand the side effects that come along associated with exercise. An optimal training program for individuals with epilepsy would be aerobic activity 5 times per week and resistance training at least 2 times per week. Aerobic activity should be moderate intensity, which is about 40 to 60% your VO2 max, and resistance training should be about 60 to 80% 1RM. It is important to do at least 30 minutes of aerobic activity, which can include walking, jogging, biking, rowing, whatever the client enjoys doing, and to make sure that they're doing it safely. When doing resistance training, it is best to do 8 to 10 exercises using large muscle masses, and for optimal results, it is suggested to do 1 to 3 sets and 10 to 15 reps for each exercise. If the patient's fitness level is low when they're starting their exercise program, It's appropriate to begin with shorter sessions to gradually build up to that goal of 30 minutes of aerobic activity 5 times a week. We just don't want them to be frustrated and then not continue with their exercise program. And with any disorder, precautions are an important part of an exercise program. It is important to take your medications as prescribed, stay well hydrated, and to know when to stop physical activity due to feeling lightheaded, faint, or dehydrated. It is also important to wear protective gear in case of falling during a seizure, and definitely important to wear a life jacket while you're in the water. It is critical to make sure that the exercise and sporting activities that the individual engages in are as safe as possible. It's also very good to let friends or family know if you're going to be traveling alone or exercising alone. They know your path and your route, so if something happens, that's actually happened to a family friend of mine, and because the wife knew where his normal routine and path was, she was able to find him and save him. And it's important to allow for 2 rest days per week. Some anti-epileptic medications have side effects that can affect performance. These medications can result in fatigue, blurred vision, impaired coordination, slow reaction time, and over time, medication can lead to osteoporosis, so you need to, well, by training, you're going to be building the bone, so it'll help. Exercise will help with that. So with my family's friend's permission, I was able to get some information regarding his case. He is 56 years old. He has no known metabolic, cardiovascular, or pulmonary diseases. He does have epilepsy, and he's been diagnosed for 6 years. He currently takes Lamictal. His blood pressure is normal, no issues with that. No family history of any sudden death, myocardial infarction, or revascularization. He lives a very active lifestyle. Him and his wife cycle at least 5 or 6 days a week, and they're vigorous, like long cycles. He competes in races. His BMI is normal, 22.6. Cholesterol level, good, 160. Fasting glucose level, 105, and he does not smoke. But based on his age, he is automatically a moderate risk, and because he engages in vigorous cycling and has epilepsy, it would probably be best that he has a medical exam and does an exercise test before beginning. And to wrap it up, exercise has been proven to be beneficial for individuals who have controlled epilepsy. It is important to obtain clearances from the doctor and to establish an exercise prescription where the benefits of exercise trump the possible risk factors. I hope you learned about some of my references, and I hope you learned about epilepsy and exercise, and thank you.